Kia ora koutou. Welcome to today's webinar on cybersecurity and health, protecting systems and supporting clinicians. I'm Rebecca Macbeth. I'm the media editor at HINS, and I'll be your facilitator today. HINS would like to thank Imprivata for sponsoring this webinar. It is being recorded and will be available to view later today on demand. So we have a fantastic lineup today. I'm going to ask each of the panelists to just briefly introduce themselves. So joining me today, we have Pete Booth. Welcome, Pete.
Hi, Pete Toko Inoa. Thank you for having me here today, Rebecca, and talking at Health Week or the preceding Health Week webinar. I'm the acting national CISO for Te Whatu Ora. I've been here for about 3 years now, started as a Central Region CISO, was GM of Security Services and Performance, and am now lucky enough to be heading up the cyber function. Thank you very much.
Perfect. Thanks, Pete. Great to have you. And Alf Egerman.
Good afternoon, everyone. So I'm Alf Ekima. I currently work for Health New Zealand, and I'm part of the Security Services and Performance team, which I'm struggling to remember just because of the fact that I recently left Cyber Incident Response, taking a bit of a break from that. So it's always difficult to remember the names of new teams. Happy to be here today. Thanks for having me.
Kia ora, thanks, Alf. And Brad Gwyther. Welcome.
Good morning or afternoon. Brad Gwyther, I'm the Principal Consultant and Customer Success Manager for Imprivata that covers the APAC region. I've been with Imprivata for 10.5 years now. Time flies when you're having fun. I look after most of the implementations within Australia and New Zealand, and I've worked with most customers across the ditch as well, from Melbourne to New Zealand. So thanks for having me. Happy to have a chat.
Great, thanks, Brad. And finally, we have Tina Sun. Welcome, Tina.
Kia ora, I'm Tina. I'm a renal physician or a kidney doctor by trade, working at Counties Monaco. For the last several years, I was working in the clinical informatics space and was working closely with the Imprivata team on tap-on, tap-off rollout in Northern Region, and I'm now back to a full-time renal clinician on the front line. Thank you for having me here today.
Great. So first we are going to have presentations from each of the panelists, and then we will open up the floor for questions. So do keep those coming in using the 3 dots button on the webcast player. But first we're going to hear from Pete. Thanks.
Thanks, Rebecca. Hopefully my presentation is showing. Look, we've been given about 7 minutes each, I think, so I'll try and get through these as fast as I can. I think it's really good to understand just how big our health environment is, and it gives us an idea of just how much data and systems that need to support the incredible volume that we see going through our healthcare system and sector in New Zealand. So with over 86,000 GP visits, 235,000 pharmaceutical items dispensed, lots of immunisations and emergency department visits alongside just all those things that happen in life. So it gives us, one big important question, which is obviously that it's a massive ecosystem, but why is cyber important in health and inside this ecosystem? There is one big reason, and that is that it's a high value target. You'll hear the stats that financial data you'd think would be the primary target, because if you can get hold of someone's credit card, you can spend the money. But really, health data is very valuable as a target from a cyber perspective. It's your complete identity profile. It might have your NHI number. It's also going to have your insurance numbers, where you live, etc. Obviously, it's irreplaceable. Your medical history is your own medical history. If you lose your driver's license, you can ask for another one, but you can't replace your medical history either. So they're the reasons why people might want this data. But also there's the angle that from a ransom perspective in a health setting, there's operational urgency and also need for immediate access. So the impact of lost data or a clinical system going down is actually very impactful, and that is why sometimes people would see that as a better target than maybe another area where there's not quite that same operational urgency. Health is as a target, which said it is. Here's just some examples. I won't go through each one. The obvious one is Waikato, where we had the DHB out for a number of days. The impact of that, the tail was very long, a lot of impact to patient services. But we continue to see a lot of attacks going on. Just recently, a medical centre had a ransomware attack in the Wellington region, and that also was very impactful as well from a patient information perspective. What are the key things? What are we seeing? Well, it's still the old adversaries, unfortunately, but ransomware remains a massive challenge in cybersecurity. Phishing as well. This is why it's really important to take notice of when you get those phishing tests in your email, as long as your organization runs them. Data breaches, this could be from third party, or it could be even from an insider, either malicious or by accident. We keep losing information. We've had lots of examples of spreadsheets go to the unintended people, and that ends up being privacy incidents. Another one that we've seen re-emerge a little bit more recently is also the DDoS attacks. We're starting to see some of that activity coming through in terms of healthcare attacks that are happening. Here's an example. This is Synovus. It's a pathology service provider in London. It was demanded after ransomware that it should provide 50 million USD. It used a double extortion tactics, which meant that it also released the data on the dark web. But this ended up in months of disruption to the frontline clinical environment as well. So lots of hospital appointments postponed, elective procedures, etc. So when these things happen, and they do, there's organizations out there that are looking for these opportunities, always very impactful. So this is the key thing. It's like cyber. I think we talk about phishing and some other aspects, but really from a cyber perspective in health, we want to be seen as helping the transformation of digital services, providing that link to clinicians, etc. We want to be able to make sure that it's not just seen as a widget factory that looks at things and processes things, but we're actually part of that ecosystem that allows us to enhance the clinician experience and then therefore give better patient outcomes. There are some cyber risk drivers at the moment. So one of those, of course, is the dual nature of AI. On the one hand, we've got, and I'll talk about this a bit more in a minute, where it's got these amazing things it can do for health. It's already doing some great things for health, but there's also a dual nature of AI where we can see that criminals can use it for their own purposes in different ways as well. Technological supremacy. We've got all these big companies really driving for control, which is the dominance of global tech firms, but also, really big nation state efforts in terms of who's going to control AI is something which is playing out right now. Also in cyber, increasing reliance on digital platforms. We're seeing much more, big platforms holding lots of information. That's certainly the case in health. And then we have this race going on at the moment, which is to adopt this emerging technology to try and be at the forefront of everything that we need to be to try and deliver those health services. We're increasingly connected. Any operating theatre or hospital room that you might be in is going to be having very connected surgical devices. So this increases, obviously, the opportunity for health improvements, but also if there's any vulnerabilities in those systems, it can exacerbate what might be a cyber attack. So here's just some examples. AI in healthcare, massive benefits, but there are some negatives. I don't know if anyone can see on the bottom there. I won't go through everything in the slide, but that's actually a screenshot from a Jack Tame interview, which was completely done as a deep fake, where they had someone talking about the benefits of I believe it was an insulin medication. It was a real person, but they were deep faked, endorsing this product, which actually was a scam. So there is, on the one hand, this is what I mentioned, the duality of AI. On the one hand, massive benefits. On the other hand, now from a security perspective, we've got more challenges around how we continue to adopt and look out for those different ways that AI is impacting us. Just a couple more slides, just to give you an idea of the size of everything. So we have about nearly 5,000 fish alerts reported every day, 59 billion security signals. Again, we mentioned this is an 84,000 sized organisation, just Health New Zealand alone. And really, it's just a massive exercise for us from a cyber exercise to be across absolutely everything. Which this is my final slide. So, how do we approach this? Well, we really need to scale. We've got this massive organization. We have to take a secure by design approach. We can't look at every system on its own. The demand for clinicians needing to access systems, patients getting treated, but then also our own environments about how do we make sure that the systems we deliver are secure is really, really important. So that's been the big thing from a cyber perspective. We're really looking at those major platforms, those ways that we can get secure by design built in. Look, I'm really conscious of time, so I'd love to hand over back to Rebecca. Thank you.
Great. Thank you, Pete. Well, it's so interesting to see, the scale of what you're dealing with on a day-to-day basis really brings it home. So just remember, we do have time for questions at the end, so do keep those coming in using the 3 dots button in the bottom right hand of the screen, and you just select ask a question. And if you've just joined us and you want to get some information about the speaker panel, then you can use the same 3 dots button and click info. And next we're going to hear from Alf. Take it away, Alf.
Sorry, just sorting out my slides there. They seem to want to run away on me. This is always the case. So I think for me, what I'm trying to understand around cyber and is how we incorporate cyber as a practice, much the way that we think about perhaps our clinical practice and what we do within that practice. I want to understand how we can begin to embed cyber into these practices that we carry forward. And so when I think about health, I think about this as a network. And so when we look at networks, we think, well, why are networks important? And really, health is relational. It's a network. We're all aspects of that network. We work together to provide aspects of care that singularly we wouldn't be able to give. And in this way, cyber, or aka digital systems protection, which is how I like to think of it, it's intertwined both in how we deliver care today, but also how we will leverage technology to deliver care tomorrow. So we're all interlinked, and how do we continue this interlinkage and move that forward? And I think this is really around connection. Connection is a major part of healthcare. Healthcare is relational. And what I'd like to really champion in this space is around creating a practice across our networks, enabling collective behavior and learning. How do we collaborate with one another? And what are the benefits that can drive strategy forward to strengthen expertise and create a cyber secure culture, which is based on trust? We're an integrated system, and this means covering all our bases. We need to share our learnings with one another. And so what one agency, one company has done, we need to build on this and actually share that collateral with one another. So building cyber resilience, more steps, big impacts. I love this picture of this icon that I found last night. I was trying to create images on AI, and it just really wasn't doing it for me. But I found this somewhere over in MIT, USA, and I think it's fantastic in terms of the eyes and the expression. But really, cyber resilience. I hate the word resilience, and I think that I don't like it because often it means the expectation of being individually resilient. We talk about this a lot, how can we become more resilient? But in this context, we're thinking about how do we become resilient across our health networks? How do we share information and build collateral? How do we share the stories and really learn from one another? And of course, all this is going somewhere. So I'd like to just point out, so whilst I was working in incident response, and huge shout outs to my previous incident response team and also Privacy, who worked really hard to develop these booklets, we built some collateral for the sector. Now, this collateral was built for and by the sector. So we had a lot of feedback groups that built into really what we were trying to show. But this came because we were seeing an increased amount of attacks across primary care. And whilst we weren't managing those attacks for primary care, we were helping them. And so these 2 books, which are available on the Cyber Hub on Health New Zealand, these are around what do you do when you're attacked, and also how do you strengthen your digital defense around privacy and cyber. They work complementary. They're dual paradigms really effectively. And in order to really fulfill and meet, strengthening resilience, meeting the effects of an attack, you need to be able to work across both of these domains. So the strengthen your digital defense is around what do you need to do when there is a cyber attack, and the strengthening digital defense privacy in cyber is around how do you work across a cyber attack when an attack becomes a data breach? What does that mean? What are your obligations that you have to fulfill? And we saw these at this time as being really important to primary care, and particularly relating to some of the responses that we were in. And I think what I'd love to do across in this space is to actually deepen into these books and really begin to think around what is some additional collateral that we can utilize. So what are the things that people really need in terms of building their resilience within their own organizations, particularly in primary care space, but also around we have the health sector is massive, and we have a lot of what we'd call the third industry around charities and charitable trusts and things like that. So what can we do to support one another in this space? Because really, at the end of the day, cyber is an ecosystem, health is part of that ecosystem, and we're all here to work together. So I think the way that I think about cyber is it's in partnership, but really cyber is quite simple at its heart. It's around protecting digital information. And why do we want to do this? We want to protect people's data, we want to protect our data, and we want to protect your data. And what do we need to do around this? Really, it's just around closing that door and making sure that we understand what our risks are and what we need to do to build resilience into the future. Sorry, this is I did happen to steal Pete's slide around this, so thanks very much, Pete, for the good words. But we think about scalable security. We have one system. We have so many amazing people in the system, and this goes for cybersecurity as well. I work with forensics. I work with people who manage relationships. I work with Pete. There's so much knowledge that we have here in this space, and we've learned so much around what we need to do to protect and respond. And what we've really narrowed it down to is what matters is before you get to that incident response. Incident response is all, we think about it as being glamorous, but really it's just hard work. So what can we do to cover those bases before we get into that actual response territory? And that is me. Thank you very much.
Well, thank you, Alf. And if you do want to see those resources, we did put them on the webinar registration page, so you can find the links there. Just a reminder to our viewers that we have the Q&A session at the end, so do keep the questions coming in using the 3 dots button in the bottom right-hand corner of your webcast player. And yeah, if you have just joined and you want to see some information about the speaker panel, you can do that as well. And if you need any technical assistance, we've also got the help button there. So we've got Brad coming up. He's obviously from Imprivata, which is our sponsor today, which we're very grateful to them. And so I'm going to pass over to Brad.
Awesome, thank you. Press the unmute button. Very good start, Bradley. A quick introduction of who I am. Brad Guither, implementation consultant and customer success manager at Imprivata. Key point that a couple of you guys have mentioned already is that partnership and collaboration. I think that's a real key point around any solution we put into healthcare, whether it be IT or other workflows, is that collaboration to make sure that we have the requirements, we work together from the business side, the IT and security side, and especially the clinical staff. I find that when those sort of 3 or 4 pillars work together nice and closely, then we see success a lot more quickly, and that time to value is seen a lot quickly. So yeah, I just wanted to hit that point that Elf mentioned there. So anyhow, Imprivata for 10 years. Prior to that, I was a customer, so I've looked after infrastructure operations, virtualization, identity, authentication, security, application deployments, a whole bunch of things. So over that journey, there's been a lot of, evolution of security. And I think these days we see a lot more heavy weighting with security being the main focus due to a lot of the reasons that Peter mentioned as well. So yeah, very apt points there. Anywho, I'm waffling a little bit. So what we're talking about today, protecting systems without slowing care. We are in that unique situation in healthcare where we want speed, but also security. And we want that race car speed without that compromise from security. At Imprivata, we sort of believe that we can have both, and you can have a sliding scale of still being secure, but have that ease of access too. And through certain policies, configurations, you can have strong security, but still be fast for our end users so they can access their clinical data, their applications, and ultimately treat their patients. So some traditional models add that friction, but we don't want that. We want that frictionless sort of that process as part of that. So at Imprivata, we deliver that security, seamless, strong, smart, and we work with our customers quite closely in that. So we can align to those requirements, those security models, etc., to make sure that what we're implementing and what we're configuring doesn't have a huge impact in change management for our clinical staff, and it's easy to adopt. It just works. You get on and do your job, but also hitting those cybersecurity tick boxes and accreditation and other models that you have to adhere to as well. And this just isn't on a desktop or a laptop, but we also extend to mobile, medical devices, whether that be on-premise or remote as well. So I guess that key point on that frictionless access, but still having security layers on top of that as well. So how do we do that? We have a vast array of products. I'm not going to put my sales hat on here because I don't need to do that, but we have a good array of products. Going back 20 years with our enterprise access management, some of you may know that as OneSign. Some of us still call it OneSign, but enterprise access management, it does exactly that. So it gives you tap on, tap off access to your endpoints, your mobile devices, automatic login to your applications, not having to remember passwords all the time. We can add multi-factor authentication on top of that. So then you have your two-factor auth, and you might have a grace period, for example, where you tap on and put your PIN in once every hour, or password 2 times a shift, for example. And this is that slider I talked about where you can go more secure in certain areas, maybe public facing, for example, and you might have a quicker timeout on those devices based on who's using them and where they're located. So again, that sliding scale of security and ease of access. As I mentioned, we've extended that to mobile. So we support iOS and Android, tap on, check in, check out, automatic lock, automatic login to your applications, auto lock, as I mentioned. And that all goes back to I can access an application on my desk, with my laptop, on a mobile device, on premise, but also outside the hospital. And we can also secure that with our solutions and our configurations too. Now, a really cool thing that was just released and has come out recently and been worked on is another, I guess, iteration of facial recognition. So we're calling it tap and smile. So rather than having to tap and put a pin in, you can use a face as a biometric authenticator. Most of us already had this on our iOS devices and Androids on our consumer devices, and I brought that into the enterprise. So again, laptop, desktop, shared devices, but also mobile phones too. So you don't actually have to, tap a badge or smile. You can do that as well. Extending that, losing my words for a second. Extending outside the tap on, tap off and mobile, we also have privilege access management. So not just a clinical support, but our administrative staff and also vendor support. We can have our privilege access management sessions recorded, keystrokes recorded, auditability, change management, that security sort of side for not just clinical staff, but admins and third-party vendors too. So we're covering the whole suite of people within the hospital walls, but also outside as well. So again, I guess to reiterate points, we want to make security teams happy and the business happy to reduce risk, but our clinicians are happier. So a few key points to click on there. Alignment to requirements, so maturity models and security standards. So I see a lot of, again, like I said, design and implementation is very heavily weighted with security. And in some of our implementations, security has the final say. So if we don't adhere to those design requirements and other models, then sometimes projects don't get implemented or it takes time. So again, we want to make sure that we tick those boxes and we can move forward quite quickly. Reducing phishing through multi-factor authentication processes, strong hardware, device-bound passkeys, all the cool things that we're doing. I won't go into too much depth on that tech, but if you want to know more, let me know. Audit visibility and reporting, and as I mentioned, controlled sessions for third parties and admins. So trying to cover the whole landscape within the hospital and also outside. But what we generally focus on, and for my implementation, is a clinical experience. So no repeated logins, not having to remember passwords anymore, no password resets. You get access to your systems easily, secure, and don't have to get that interruption of what you're trying to do to put in your passwords when you're trying to treat a patient or put notes in there. If you're having to think about passwords and what you're doing, then things get forgotten, or you write things down, and then, yeah, that's a bit of a risk there as well. One tap, one face, rapid access across devices, across the whole ecosystem, always secure, never slow workflows. So I guess that's the balance that we want to look at. Still secure, ease of access, but bring the clinicians on the journey. And generally, like I said, our solutions are fairly easy to adopt. A little bit of change in comms, but it's a good solution for IT and clinical staff, and should make people's jobs easier. A couple of quick highlights before I hand over. As I mentioned, Tap and Smile, really cool product feature we've got in there. AVD integration for virtualization with Microsoft products, a unified admin experience. Over time, we've had multiple products and features in part of our stack. We're now unifying that look and feel, so it's one pane of glass to be able to manage and implement our solutions. And as I sort of see in the future what's coming, that journey to passwordless. So I've always said passwords will always be around in clinical space, because we have legacy applications that have been around a long time. They don't always align to development modern standards, so they're always going to be there. However, we can automate a lot of this login procedures and access, and add multi-factor authentication on there, and analyze these things so a clinical staff member doesn't need to know what it is, and we can manage that for them. They can tap on, smile, and they can log into those apps on across different devices and not have to know that password. So I guess that reduces that attack surface for people phishing and things like that. I guess one of the key points is working together, as I mentioned before, and we all talked about collaboration and partnership. And I firmly believe, and we firmly believe that, yeah, working with our customers and other vendors and partners makes that whole ecosystem a lot more successful. But my last point is, don't forget our patients. I guess we do a lot of this implementation and security and analysis because we're trying to make a patient's life easier and clinicians be able to treat their patients. So that's also key to the back of my mind about why we're doing certain things and what those outcomes are going to be, and measure those too. So maybe a little bit soapboxy, but yeah, firmly believe this kind of stuff, and hope we can help you out with some of our solutions and analysis. So thank you.
Great. Thank you, Brad. I'm sure that's going to have sparked some questions from the audience as well. So important to bring it back to patients in the health system, isn't it? And yeah, just a reminder, keep those coming in via the 3 dots button in the bottom right-hand corner of the webcast player, and just select Ask a Question. I also like that idea of making security teams happy and clinicians happier. So looking forward to hear next from Tina, who is one of those clinicians working day to day, about her experience of this approach. So thanks, Tina.
Hello. So going back, the passwords. Yes, everyone keeps talking about passwords, and I'm not here to tell you to change your passwords, because we know how difficult it is to change passwords at times. And please don't change your password to let me in or password 1, 2, 3, 4, because that's the problem. So thank you for having me here. And I have to say, what a great talk from Brad, Alf, and Pete. So thank you, Pete. Firstly, your team has been doing all the hard work, fielding all the attacks before it become an incident that actually impacts on the patient cares. And firstly, also totally agree with Brad, your talk about how we can get the vendors and the clinicians and the security team to collaborate together. Just like Alf, you've mentioned, it's a network, and ultimately all we here are for our people, for our patient that we want to care for. So one of my favorite persons said to me this yesterday when he realized I'm doing a talk. He said, well, okay, so you're not here to tell people to change to a 37-digit password. You're actually telling people that how do we make cybersecurity simpler and in line with our clinical workflow, and so that it's non-intrusive in my day-to-day of work. So we don't have to pick either security or clinical efficiency. We can actually combine them together, and this is through a collaborative process, and how we can ultimately achieve something that is aligned with our workflow, that is usable, that's intuitive, and so that it helps, so that we embed cybersecurity within the system in my day-to-day of work, and makes it easy to do the right thing so that everybody wins here. And we're talking about everybody, not just doctors, nurses, staff, but also, the security people, the admins, the IT, digital support personnel, and ultimately for everyone in the ecosystem. So I was fortunate enough to work alongside with Brad and his team and with a big, awesome digital team here in Northern Region. And we deployed the enterprise access management, which Brad mentioned, and it was a tap-on, tap-off. So essentially what it does is a single sign-on to access multiple applications with one set of credentials. So no, I don't have to remember my 37-digit password for the rest of the 20-something applications. It's been deployed to all 4 major hospitals in the Northern Region. So that's Te Tokoro, Waitemata, Te Tokatuma, Auckland, and also Counties Manukau, where I work. And it was a very strong collaboration between the clinical services and also Brad and the digital team to facilitate the entire implementation adoption. A lot of the configuration and corporate privacy, clinical governance, very simple stuff. How do we onboard and offboard users when we have got rotational junior doctors who come into our Northern Region to work? How do we set the timeout? When do we set the timeout? How, etc. So some of these really, what seems like simple questions or configuration actually had a lot of thinking behind it to understand. And then Brett and his team worked closely with us to understand our processes. And on Go Live, we had a lot of feedback mechanism and was able to make some rapid adjustment and amendment. So a bit of a data. Thank you, Brett, for pulling it out. Since we went live in October 2024, we've had 4.1 million tap-on events. So basically, this is the number of times a user has tapped on using one of the tap-on, tap-off reader. So we've got about 1,000 computers in use daily. They're in different mode. And this is another clever thing, is that they actually do have different computer modes so that we can actually decide what type of device in what sort of clinical areas. And there are 5.1 million single sign-on event into application and into some of these key big applications that we use: Regional Clinical Portal, MedTasker, Central, MedChart, TrainCare, and Patient Track, etc. And we assume that it takes about 6 to 7 seconds each time a user needs to type in their username and password, as long as it's not let me in 1, 2, 3, 4. So it actually saves a lot of the hours. So little things do add up. So these are more time saved using kiosk user switching rather than logging in and logging out, or user walking out of the device and then leaving things open and someone else log in. So heaps of benefits from that whole patient data privacy as well. Ultimately, what we're here to do is to enhance clinical efficiency so we can reduce the time spent trying to log in and out as I move between devices, wards, etc. And then really rapid switching at the shared workstations, improve security from a cybersecurity perspective, but also patient data security, and streamline access. So ultimately, what we want is to actually focus on what we can deliver for our patients. Thank you.
Great. Thank you so much, Tina. Great. So we're going to go into questions now. The first one I might direct at you first, Pete, which is, what are some of the key lessons learned from recent cyber incidents in the health sector, and how have they shaped Health New Zealand's national incident response approach?
That's a great question. Thanks, Rebecca. Look, every cyber incident is a little bit different in terms of what we see and how they occur. But what doesn't change is our ability to respond to them. So I think that what have we learned from it is really the sooner you can get onto it, the better. So we've found with our national SOC that we have alerts coming in, but really having every single endpoint on a laptop, etc., letting us know what's going on has been really pivotal. It has allowed us in some occasions to see an alert, something's gone wrong, and we've fixed it in minutes. have it really minimizing the exposure time so that that stops the impact. And the more we can do that, the better. And I think we are really lucky to have a fantastic SOC here at Health New Zealand who have done that on a number of occasions. And some of those could easily have become a Waikato-sized incident. But in terms of really lessons learned, I think if you are in an incident, the communications is really, really key. Not only having the structured team, if you're lucky enough to have that structured team. If you don't have the structured team, you need at least to have the structured approach. And part of that will be the comms. And really, it's understanding who your stakeholders are. One of the key things that can make managing an incident very messy is not really having that comms organised. Some maybe people not hearing about it who maybe should hear about it. You start to get more and more people involved. Some people start to manage things which they maybe don't need to. But if you don't know, you don't know. So I think the learning there is having that strong communications plan is very key. It's certainly in terms of understanding your stakeholders. And one of the big things recently has been third-party incidents where, we may not be directly responsible for a system, but we certainly are responsible for the data. So when we do get engaged in those scenarios, just making it really clear as to what expectations are is very key as well, and that helps drive the better outcomes. Hopefully that's a good answer. Thank you. Yeah.
Thanks. Yeah, that's interesting. That's the whole sort of Health New Zealand perspective. Alf, I was wondering, you're obviously reaching out into the community as well. So for providers working in the community or just people on the front line, what are the challenges in those smaller organisations to maintain good cybersecurity habits, and what would make it easier, do you think?
Well, I think, Health New Zealand is an incredibly large organisation. We are lucky to have the support of really amazing teams and people to be able to do what we do and to mitigate problems before they become incidents. But I think within that primary care sector, and this is part of what I'm trying to establish, is really around creating that good collective, that networking, where who has the collateral and what can we do to share that? Because it's about creating resilience. And when you're working with a lot of systems that are quite old, they don't necessarily come with, the right protections across them. So in order to create those protections creates a new amount of workload, and that workload is then often buffered by clinicians with the, let me in 1, 2, 3 passwords or no password at all, or shared passwords. So I think it's about continuing the good education, continuing the sharing of knowledge, and letting people know what actually happens within a cyber incident and what kind of damage that can cause. Because if we embed good practice through education, through sharing collateral, we can actually mitigate it before it becomes an incident. And we just need to embed it into the ways of working and work on how to make it easy for clinicians, because the last thing we want to do is to interrupt that, that cognitive load that they already carry by yet another 7 passwords and another MFA and another thing and another that. So I think it's around creating that practice.
Yeah. Did you have any thoughts on that, Brad, about, advice around maintaining good cybersecurity in all different organisations? You've obviously worked on both sides of the coin in this area.
Yeah, there's a short answer and a long answer, or a probably medium answer in there somewhere. A lot of it is about that communication and the policies that security has. And I think over many years, especially probably the last 3 or 4 years, that the cyber side of things has increased in weighting, as I said before. So when you look at the certain workflows in an organization, and I guess from an access point of view, how a user can authenticate. So traditionally, username, password, getting more complex, a lot harder to use. So looking at different modes of authentication, as I mentioned, tap on, tap off. We now have facial biometrics, look at fingerprints, hardware devices, other things like that when the phone, but also looking at the analytics side of things. So if I'm at home, maybe I should have remote access and multi-factor more often, whereas if I'm on a ward, I can tap on, I don't have to put a pin in all the time. I can put it in certain times in my journey throughout ward to ward, for example. I guess from a maturity and other vendor partnership point of view, I think as we start to mature and work more closely together with other vendors, those integrations with Active Directory, with the likes of Microsoft, other applications, that clinical apps and how they're inbuilt with access, and reducing that password interaction and making more modern authentication standards and integrations makes it, again, easier for a clinical person to do their job and access things, but it's more secure on the back end. So there is a bit of a balance again, that sliding scale, as I mentioned. But it goes back to the impact of the clinical person. It should be easy for them, but still secure. So there needs to still be some education there around why we're doing these things. Otherwise, they won't do it. So a little bit of change management, a little bit of comms, a little bit of balance, and I think that moves the needle and starts to move that maturity model a little bit more quickly.
Right. That actually leads on nicely to the next question, which is from Isabella. She's asking, do you have any ideas or suggestions about how she, as a manager heavily involved in digital midwifery delivery and health systems, can keep staff aware and updated? And are there any key behaviours or actions you suggest she tries to get embedded as a routine for staff to help protect Health New Zealand systems? So it might be for you maybe to go first, Tina. What's your advice for those trying to get clinicians on board?
To get clinician on board, so going back to the original thing, make it easy to do the right thing. So I think that is a key concept here. And for a lot of the clinician, ultimately we want to be there to provide good care. So there are a lot of the lessons learned, which I think we can make it a bit more tangible. Ultimately, think about it in the sense that cybersecurity actually link directly with patient security or patient safety perspective. Because if you think about it, with the Waikato ransomware attack, it impacted a lot of the service delivery. The clinician would not be able to access information when there is actually a true incident. So I think these are some of the key messages that cybersecurity is not just IT team's problem. It's not just Pete's team's problem. It's actually all of us. And we as frontline clinicians, we also have a very important role in the cybersecurity defense. But ultimately, are there processes or ways that we could actually make it easier and reduce that cognitive load that we already have as busy clinicians?
Yeah. Do scare tactics work, do you think? Do you like to
The
scare
scare
people into
Well, I
submission?
think a little bit. I guess the thing is making it tangible and what it truly means on a clinical front line when there is actually an incident. I think for a lot of us, we are not so clear in terms of what are the true impact. And maybe because Pete's team is doing such an awesome job that it never really hit us in any ways. But I think just having that message is that we want to, in a way, it's a bit like clinical medicine. Prevention is better than treatment. So if we can actually block a lot of these little attack before it becomes a true incident, I think that's probably the best analogy that I can think of in the cybersecurity is prevention is all the way, and it's all of our responsibility, and screening for all these phishing emails, etc. And if in doubt, then report it. Just like if you see an abnormal blood test result, you would do something about it.
Right. Thank you, Tina. This question is about how to optimize SSO when a user has multiple accounts with the same provider. I have to say this is going slightly above my head, so hopefully one of you can answer it. It's asking, what's your recommendation for helping users manage multiple SSO accounts when logging into web applications? For example, a user might have Microsoft Entra account within the hospital, but then might use a third-party web app which uses a different Microsoft Entra. And are there any downsides to using browser profiles to manage this situation? Who would be best to
I can take this one. Without going too deep technically, we have a feature for multiple accounts within our single sign-on engine. So all staff can have this, or certain staff can have it, or the staff can maintain it themselves. So as part of our single sign-on process, you can have multiple accounts for single sign-on and automatic login for some of those applications. So as you profile and deploy application password managers in our software, we can have that feature. So yeah, I'm happy to follow up whoever asked that question, and we can talk more around that if you need to.
Yeah, actually, another one which is on a similar vein is about what are your thoughts on password manager applications also providing MFA for the same accounts? So the manager provides a password, then provides a tap on, tap off, rather than that coming from another factor, and keeping in mind both could be on the same phone.
a little bit more technical, but I guess this is what comes back to how the user is authenticating, what those integrations are, and I guess a new word is signals. So what's the user behavior? Is it unusual? What device they're doing it, when they're doing it, and what policy you need. So again, back to that sliding scale, that if the application can be integrated, and through our software and solutions, we can have integrations for authentication, re-authentication, multi-factor at the login side of things, or at certain points on the endpoint. So there's different parts and different I guess, locations in the workflow that you can enable multi-factor or automatic login, or based on the policy, ask for stronger authentication, for example. So again, that comes back to what are the cybersecurity requirements that are needed for that login to that device and that application, and where's a slide on the ease of access. So yeah, generally somewhere in the middle is good, but we can have those policies set up on different workstations, different people, different applications, and you can pick and choose what you want to deploy.
This is a sort of broader question, might be something you might be able to start us off on, Pete, but I'm sure everybody's thinking about it. So it's just talking about, we've seen the last days, weeks and months that big techs are not as secure as most try to tell. So we're talking about, Health New Zealand systems in particular being attacked, but what about our dependents? They're talking about big techs that are under other national regulations like US or European. Are there any platforms that are really only in the hands of New Zealand regulation? And you can try and stay safe, this the comment, and do anything, but if you're depending on these large, big platforms, you still have a gap in your options to manage the security. How do you think about those issues? I'll start us off, Pete.
Yeah, it's a good question. I think it was mentioned in the cyber risk, because, more and more we see a sort of aggregation towards the bigger platforms providing security or just general services plus security to organizations, and look, Health New Zealand is no stranger to that, and you get a lot of benefits from that scenario as well. So typically in those larger platforms, you'll get this possibly a better security roadmap, you'll get more security features, etc., as they come. Obviously, a lot of that comes down to sometimes how you employ that platform. Are you going to enable MFA for when your administrators access that platform to do something, or how good is that control? So there's a few questions there. There was a few questions there around data and data sovereignty and where it is. And yes, you should know where your data is, at least from a privacy perspective. Here in New Zealand, I won't go into the absolute rules, but typically we see Australia and New Zealand as okay, and then we tend to look into where it goes anywhere else. Generally, the rule has been if they have equivalent privacy regulations and rules, that's something which we would look at as well. So, but I think if you just don't know where the data is, if it's going somewhere where you feel that your data would not be protected as well as it would be in New Zealand for whatever reason, then that's something you should really consider as whether or not it's an appropriate platform to use. Yeah, I think it's probably my best effort on that one. Thank you, Rebecca.
Yeah. And I know you mentioned privacy there. I know that's a real topic of interest for you too, Alf, and you sort of touched on it a bit in your presentation. But what are your thoughts around privacy of information and sort of reliance on big tech in many instances to keep our data safe?
Well, I think that, this is a tricky question, and I'm probably not the best placed person to answer it, but I think that there's a real, be really careful about where you put your data and into what applications you put your data, be that from an organizational or a personal use. And I think the other thing to be aware of as well, and not naming any names at all, but when you're thinking about the big tech and you're thinking about those big corporations, what third-party apps do they have that are reaching into that technology, and how secure are those? Because you might have an amazing, customer solution, but actually it provides some application or some processes that are built into third-party applications. And so what do we know about those third-party applications? And I think that's that is where people tend to get caught out because the big technology platforms, they're good, they have good assurances around it, but actually what's using them? And that's more to the question. So when you sign an agreement, be really careful and make sure that legal get a really good look at it and what are you actually agreeing to and what is your responsibility if your information should somehow become breached or should become part of a privacy breach. I think that's where I'd go to with that. Privacy and cyber, they work side by side because obviously within health, data is a key driver for attacks. So what is the recourse if something has been attacked and there's a privacy breach? And oftentimes that will involve people like the Office of the Privacy Commissioner. It will involve contacting people. There will need to be an evaluation across what is the serious harm that could be caused by a person as a result of this breach. And so there are all these assessments that way. And so when you think about the attack up front, from whatever reason, then you continue down that pathway. The privacy aspect of the breach response is actually much longer and has a much heavier tail to it than the initial response to the attack. I think I waffled a bit out of context there. Sorry. I was following my own chain of thoughts.
It's very interesting because, yeah, like you said, they're so closely linked. And yeah, talking about big tech and what they do, AI is obviously becoming increasingly embedded in health systems. So be interested to hear the panel's thoughts on what new cybersecurity challenges or safeguards do you think will be most important as we start to rely more on AI tools in the health sector? Who wants to start us off on that one?
I'll give a quick opinion. It's a very real issue that we're grappling with at the moment. I think we've made good progress in understanding how to bring in AI in products. Quite often it's embedded in products already. Then obviously there's the other models which can be used. We've had to create what we call a sort of fast track process where it's more productivity, augments how someone might work. From a cyber perspective, we're not so worried if you're getting some meeting notes, depends on the meeting, of course. But that's different to a clinical AI, solution, which is solving a very clinical need. And that would go through a very different path in terms of, I always get the acronym wrong, but the National Algorithm Advisory Working Group, it's called NIAG of all things. But, they'll look at it from a clinical outcomes perspective. And it'll take that, very much more thorough route in terms of how we might want to onboard that particular piece of AI or, introduction of AI into a clinical solution which is already in place. So we have to take short answer to how I've answered it, but we have to take a two-pronged approach here where we understand what doesn't need to be looked at as much versus some of those things which might have a patient impact.
What about from a clinical perspective, Tina? Have you been thinking about this in terms of, the risks for clinicians as AI tools start to be introduced?
I guess it's something that we need to be going in with an open eye. And like what Pete said, when it comes to AI, there are two prongs to look at. One is the actual security part of it, of the actual system. But then secondly, there are things about data storage and the data use, because ultimately AI is feed from data that we give into it. So that's pretty much unanimous across all AI tools. So we need to be very mindful of that whole data sovereignty and data governance. And I think this third thing, and it's actually very timely because AI, and it depends on the output and whether or not we're talking about generative AI versus some of just the machine learning or algorithmic ones. Recently, I was marking a medical student case history, for example, and it was very clear cut that the history was actually written by AI. And there is that inherent confirmation biases because I guess for a student who may not have had enough clinical experience, just took the entire output as accurate. But for someone like us who have gone through a lot of the clinical work and specialty training, it's quite obvious that the AI output isn't 100% accurate or relevant in our New Zealand setting, for example. So I think these are some of the key challenges that we need to face as clinical workforce and trying to get that balance going. What are the safeguards that we can put in? And like what Pete said, NIAC has got a group of experts who will evaluate these tools in terms of reviewing some of the clinical outcomes and how it improves with clinical efficiency, but also address some of that data sovereignty, data governance, and then most importantly, how do we as clinical workforce put enough governance around some of these tools? And ultimately, accountability and responsibility should, who ultimately makes that call?
Mm. Yes, that's a big question. Oh, yeah, it wouldn't be a digital health webinar at the moment without talking about AI, but we will move on. There's a specific question for you here, Brad, actually. This is from someone working in primary care, just saying clinicians often have to sign into multiple systems, applications, and websites that are not controlled or managed by the practice or the PHO and don't all have SSO capabilities. So can Imprivata handle all these different credentials and create a seamless sign-on experience regardless of what app or systems those clinicians are signing into?
Short answer, yeah. That's pretty much what our core product does, our enterprise access management. So we can recognize those screens that require login credentials, and we'll save that on a successful login for that user. We have control, and you have control as a customer around which applications you choose to save that for, and basically have an enterprise-wide password manager for your users. So yeah, that's the bread and butter and the save time and security side of things. So yeah, if it's easier to do that, then people will lock endpoints and close out of applications rather than keep them on if they're having to sign in over and over again. So yeah, short answer, yes, that's what we do. I like the AI chat as well. If I want to go back one step, I'm excited about AI, and if you're not doing stuff, then you're going to be left behind. However, I'm also scared because, like Tina said, it's trust but verify, because sometimes if the information's not right, then that can have consequences. So that governance is really quite key around that stuff. But the user behavior, what people are doing, efficiencies in healthcare, AI's been around for a while now, and I think decision making and clinical pathway type stuff's been in application for a long time. It's that next evolution of that. So yeah, I'm excited but scared at the same time. So yeah, that was 2 cents for Brad. So anyhow.
Yeah, you're probably reflecting most people's emotions about AI at the moment there, actually, Brad. And so this is another question, just talking about with tap on, tap off, there's an access card. Does that, perhaps is for you, Tina, does that create a kind of point of failure if clinicians lose their cards or it's stolen? And what processes around access card management do you need to prevent that?
So it's actually interesting you mentioned that. We debated it. And so the way we've set it up is the clinician actually have to put in their own password for the first time of every day. Yeah, so it promotes that. So if you lose your card, at least someone is not going to be able to take that card to tap into our computer system. And the way we have also incorporated the card is we tied in the card with your hospital security card, which is actually quite obvious because you need that security card to get into like wards or medication rooms, etc. So it's actually convenient in such a way that if you lose the security card, people realize it straight away. And there is a IT process set up. So our standard operating procedure, basically anyone who calls up, they will be able to deactivate the card straight away.
Mm. Oh, it's great that you've been able to combine those. Unfortunately, we have run out of time, so I am going to have to wrap it up. But thank you so much to our brilliant panel, such an interesting discussion, and to our sponsor Imprivata, and to all of our viewers for joining us today, contributing your questions. And thank you for supporting HINS. You can learn more about cybersecurity and health across New Zealand if you come along to Digital Health Week, which is running from November 24th to 27th in Christchurch. We would absolutely love to see you there. Mā te wā.